healthcare, the money is saved at primary care level and preventative. You know, wellness and primary care is where it's cheap and effective to spend money. You know, MRIs of somebody's sinuses is a high dollar solution, you know, for, you know, or total body x-rays like they have to do in Knoxville. If a poor person's in a car wreck, they do a total body scan. Or, you know, a sick person can't even get a total body scan if they need one because it's being wasted on, you know, people who are afraid they're going to get sued, the hospital, you know, afraid they're going to get sued. So if an indigent person comes in, they get all this, you know, extraordinary care. And if the doctor actually knew the families and multiple generations of the families and the cousins like my father did, they don't need all these tests to tell them what's wrong. They know what's wrong. They know why it's happening. They know how the families responded in the past to various treatment methodologies, and, you know, they give them a very low-tech, very effective solution. They don't just get, you know, draw blood. Nowadays, you know, it's been shocking to us to have to go to a doctor now for the first time in our life and try to get drugs. You know, the pharmacy, it's just like some kind of a hazing process to try to get a bottle of aspirin. You know, it's really, really complicated. And there's no reason for that. The doctor, when the patient comes in, the doctor should be able to tell what's wrong within just a couple minutes of listening to them. But now it's all, the tests are all ordered before the doctor really talks to you. And that's strange. It's very expensive.
Do you think that, you said you finally got a new doctor for your community, from the community. Is he able to practice the way your father did in any respect?
No, and he says he gets a lot of grief for it from the patients.
I'll bet he does.
And they say, no, that's not how Dr. Jourdan did it. Dr. Jourdan would just give me, and so he has had to write people just, you know, whatever medicine. They said, Dr. Jourdan would have given me this. You know, don't send me to the hospital. I don't need an ultrasound of the abdomen. I just need some Pepto-Bismol or whatever. You know, they know what they need. But, you know, this guy can't use pliers on people either like that.
Yeah, that was another great story.
He was grandfathered in on a lot of type of methodologies that are not mainstream. He can't treat animals. He can't x-ray goats. He can't use pliers to remove foreign bodies.
Yeah. Do you think there's any chance we're ever going to get back to that kind of medicine, that kind of a community?
Well, if they bust the healthcare system, we'll be right back there, yeah. I'd say that's coming. The day after the healthcare vote, the front page of the New York Times, Los Angeles Times, USA Today, Wall Street Journal all had articles about the lack of primary health care, doctors, the shortage, and it was like, hello.
Yeah.
Hello. But it's not glamorous, you know, nobody wants to do that because they, this is on video, I'm editing myself highly, but like Daddy had a friend, Daddy had a friend that went away to be a specialist, and then he came back. And Daddy said, what are you doing back? And he said, I miss getting vomited on. But it's true. I mean, I know what he's talking about. Daddy knew what he was talking about. You miss being right up next to people who are truly sick and need help. And there's only a few things they can do onto you. And Daddy, they call it on you out where I live, but you know, stuff gets on you. And if you're not one of the doctors where stuff gets on you, that's supposed to be humiliating to get stuff on you. You don't want to get, you know, the urologists have all been peed on. They've had their shoes peed on. You know, it's just part of it. Medical work is very humble work. Even, you know, a brain surgeon, it's messy.
I've often thought that being a family practitioner like your dad is the hardest one of all. Because I thought, you know, like, if I were to work in the world of books, for example, and I only did mysteries, that would be easier than trying to do all of the kinds of books. And to look at a person, no matter what they have, and be able to diagnose it, that seems incredibly tough to me.
And the Daddy's a genius at it too, but I think it's partly psychic. It's not even a normal skill. But some people are better, you know, at bookkeeping. I couldn't do a bookkeeping. Mom is good at that, you know. Some people are broader or better at the emergency room. Some people are better diagnosticians. Some people just want to do one thing and be the world expert on that one thing. It's just personality and temperament.
You reminded me of another question.
Daddy would have been bad at being a specialist.
You wouldn't have had fun doing it, doesn't sound like.
No, and if you don't like it, you're not going to be, good at it. You're going to hate it. He would have hated being like a brain surgeon.
You need that passion, I think, to be good at something.